Welcome to High Tea with Grace, where we spill the tea on HIT. I'm here with Dr. Milan Radovich from Caris Life Sciences to learn a little bit about what's going at ASCO 2025. If you don't know, ASCO is the nation's largest oncology conference, and Dr. Milan is the SVP and Chief Scientific Officer at Caris Life Sciences. So tell me, what are things that you are hearing in the ASCO hallways, and what presentations are interesting to you?
Well, thank you so much for this opportunity. And obviously, it's exciting to be back actually in my hometown, Chicago, where I grew up for ASCO. And been coming to this meeting for almost 20 years. And first and foremost, fun to see old friends, and also fun to see what's evolved in oncology with some really neat advances. First of all, I want to give a big kudos to the Caris team. 37 accepted presentations at ASCO, a tour de force in cutting-edge research and precision medicine. A big shout out to Dr. Joanne Shu and the CTRT team, Dr. Sledge, Dr. Hamrick and the POA team, and all the Caris team members that really made this reality happen. A really A+ job on that work. Multiple exciting things here at ASCO. Obviously, some exciting things from the Caris perspective. We have a oral abstract based on a trial called Clinevo. This is a trial that's testing neoadjuvant abemaciclib, which is a CDK4/6 inhibitor, primarily used in breast cancer, but now being tested in bladder cancer. And what this abstract is going to show is some really neat efficacy in treating bladder cancer with this novel agent. But importantly, Caris testing was done on all the patients of this trial, showing that both our tissue testing and our blood testing with Caris Assure, that we were actually able to track responses or progression to this therapy using our testing. So I'm really excited about this merger of a novel agent for bladder cancer, along with the ability to use molecular profiling to determine how these patients are doing on trial. Another piece about ASCO this year, and again, I'm very biased being a drug developer, is really the excitement in novel therapies. And so what we're seeing is some fantastic sessions in developmental therapeutics with novel antibodies, bispecifics, novel vaccine therapies fused to the treatment of cancer. And this is particularly near and dear to Caris's heart because within Caris, we have a division called Caris Discovery. We have about 60 people who are dedicated to identifying novel drug targets for cancer. And so we are working on our own antibodies, our own bispecifics, our own antibody drug conjugates, and excited to be partnering with several of our pharma partners to advance these therapies to patients.
Truly incredible. It's just amazing to see the innovation happening in this space. Could you have imagined even 5 years ago what we're doing now?
Absolutely not. It's really been light speed recently in the advances of treatment of cancer. And what we've been seeing is really impactful, meaningful improvements in overall survival. But obviously, we still have a long ways to go. Unfortunately, there's still too many patients who still succumb to this disease. But I think what we're seeing is it's just being chipped away, very dramatically with these novel advances in therapies. The other thing I'd also like to highlight is really the advances in drugs that need a genomic mutation in order to be able to give them the drug. And, Caris has been at the forefront of this since 2008. We really pioneered the idea that we can understand how a tumor ticks by looking at its genomic makeup and matching the right therapy. And without fail, what we're seeing every single year is these novel agents, positive clinical trials that require a biomarker. And frankly, a cancer patient today without molecular profiling really is essentially malpractice. You have to use molecular profiling to identify which patients are positive for these markers to benefit from these drugs.
Fascinating. Now, I'd be remiss to not ask you about AI. Where is AI having a role in all of this?
I think we're really just in the beginning innings of how AI is going to revolutionize the way we do diagnosis, treatment, drug development, prognostication. What we're seeing early on is, for example, great advances in digital pathology, the ability to use AI on H&E images and IHCs to predict things like recurrence, prognosis, molecular makeup, including the tumor mutational makeup. What we're seeing is just the beginnings of drugs that were developed with AI entering clinical trials, literally the first phase 1 trials happening as we speak. But I think moving forward, a lot of advances as well in things like signature development to determine which patients may benefit from the therapy or what is their prognosis given a particular molecular makeup. So I think what we're going to see is a lot of this being incorporated as mainstay in the future research of cancer, for sure.
Absolutely. And bringing it back to the patient, how could some of the innovations happening in this space, how are they actively just helping improve diagnosis, treatment, and outcomes?
Well, it's interesting. At a base layer, what we've seen is a paradigm shift in how cancer is looked at given molecular information in AI, just even the last 5 years, but definitely over the last 10 years, it used to be this antiquated dogma that cancer was really just based on organ type, right? So breast cancer, colon cancer, liver cancer. But what we know now is it's much, much more about the molecular makeup of that cancer. What makes it tick at its individual level? And I think in precision medicine, what we do at Caris, this is where science meets clinical care, right? It's really the forefront. And when I used to lead a precision medicine program at the university before I came to Caris, I would tell patients, I said, you're getting the Star Trek of technology. We want to figure out what's making your cancer tick. We're going to try to look at every potential drug available, either approved or in clinical trials, and we're going to try to stop this thing. And I think patients are tangibly feeling now the impacts of advances in science for their care.
Fantastic. Well, I've loved learning from you. Thanks for joining me today.
Thank you.
And thanks to you folks for joining us too. Check out IT Heard in the Halls for more great interviews like Dr. Milan today. Cheers.
Cheers.